This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch right here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And you know what we do here on the program. We give you the who, what, when, where, why, and how of Innovative Medical Associates and how they can help you and your family improve your overall quality of life. And Dr. Molly will be doing that throughout the course of the show. And if you have a question, 855-839-1210 is the number here in the studio, 855-839-1210. Dr. Molly is here and ready to talk to you, 855-839-1210. Dr. Molly, it's a good day because it's not only a good day to get healthy, but it's not going to rain.
Not only is it going to rain, but everybody's excited about the Eagles, John. You know that.
Yes.
Come on. I'd be surprised if anybody's listening. They may be out already tailgating, right?
Well, they can listen to us while they tailgate.
True.
So tell us about Innovative Medical Associates, what you do and why you do it.
Sure. John, Innovative Medical Associates is a group of like-minded medical providers, and we all work out of our facility in Marlton, New Jersey. So we are a licensed primary care facility, so we're able to do anything a normal primary care facility can do. Think of it as your old-time GP. If you need a medication, it can be prescribed. But the philosophy is what is different. Our philosophy says, let's use the least amount of pharmaceutical necessary to effectuate the change for a patient's condition, keep the patient out of harm's way, and also do this in a way that can minimize the side effects, not only from the condition, but also from the pharmaceuticals, which have too numerous to count today.
So that's why you really go away from the pharmaceuticals because of the side effects.
Exactly, John. And if you look today, there are so many new types and categories of pharmaceuticals out there that are biologics and new molecular and all types of things that are being used clear across the board for most conditions that are out there. And sometimes, you know, what's interesting, sometimes doc will order an oldie but a goodie for patients. In other words, you know, not something that's new and just came out, but something that's been around for a long time. Thing that comes to mind is something that we use for some of the cholesterol problems that isn't a statin and isn't the newfangled ones that you take, you know, the injection as you had, blah, blah, blah. And utilizing that, it's a powder actually. It's old, but it's great. And utilizing that for a short term until we're able to bring in the nutraceuticals that can help reduce the cholesterol and the triglycerides.
You know, there are a lot of skeptics surrounding your business. And I always ask you this, and tell us, does this work?
Well, I think the bottom line, John, is the proof can be in the blood work or the laboratory data, which is the quantitative data, and we can show reductions in lipids, we can show reductions in proteins that may be contributing to a condition. But I think the best way to talk about this is we're all about improving the quality of life for our patients. Because generally, people come to us out of desperation, right? It's their last-ditch effort. They've tried everything. It's not working, or the side effects are too great from the medication, or they've been re-diagnosed. Let's say it's a reoccurring cancer, this kind of situation. So what I say is, let's talk to my patients, come in for the free consult, and we can show you. You know, John, there is no doubt that our patients are the driving force for what we do.
Yes. And, you know, we have to talk about the stroke that I had over a year ago.
Sure.
And I have to attribute it to your protocols because the recovery and you even said it was very, very quick.
And thank God for that. And
So-
I would say you can't attribute it just to me. It's to the good Lord. He had a hand in it. Miracles happen, John. Miracles happen. We have to ask for them sometimes. We have to pray to them, but they happen. And in conjunction with utilizing the protocols, I think we brought you around rather quickly. I had a funny experience this week. One of my patients came back from a biopsy. She's an older woman. She's in her 90s. Her daughter is a nurse and quite skeptical, I might add. She came in quite skeptical, and she had a biopsy, and it's a reoccurring breast cancer. And I can tell you, she was so excited to be back. She kept bothering her kids. Listen, I want to get back to Dr. Molly. Now, they have serious other problems. Their dad is also severely sick, and he's on hospice. So, I mean, they're inundated, but I was so happy to see her, and lovely Linda and the nurses. We were also happy to see her. So she comes hobbling in, and I was actually instrumental in getting her the biopsy because she was resisting doing this little biopsy again. And we chatted about it, and of course her nurse daughter was very upset that she wanted to come to us rather than, I said, no, I don't want her to just come to us. I want you to have the biopsy. In fact, this woman because she said, where's John DeMasi, little gray-haired lady? I said, well, he's in on Tuesday. She came in on Thursday this week, I think much later than you. And she said, where's your host? I need to see him. I want him to see how good I look. And she did. And she's going back for a lumpectomy, possible lumpectomy. And there is a case of, does it work? Yes, it works, and it works in conjunction with traditional as well.
Managing expectations, I guess that's what you have to do.
John, I appreciate what you just said because I think that's it. I mean, obviously, when you have a patient who's in her 90s, nobody wants to see her undergo chemo or undergo surgery, even her nurse daughter. But she also wanted her to be around for quite a while because she's pretty lively, and rightfully so. So there's a good example of what we do. We try to use the best of all worlds.
How many treatments, speaking of managing expectations, how many treatments can you get and then start to see maybe results?
Well, and I know, it really depends on when you came into us in your status with your condition and what's your quality of life when you came into me. Obviously, somebody who's confined to a wheelchair and has ALS, her expectations can be that if I can just give her a couple of good days where she feels some of her muscles stop having a spasm, she's in good shape. Obviously, the kids' expectations might be to get her out of the wheelchair. But, we have to be realistic, and we tell patients that. But, again, it's going to depend. 5 weeks to 30 weeks. It depends on why you're here and where you are in your continuum of the condition.
And there are those that are like me who are lifers.
That's right. Well, John, to tell you the truth, as we get into some things today, I think we should all be lifers in terms of our lifestyle, and this, to me, medical hydration fits right in with that. And we're going to talk a little more about that because, again, we're exposed to so much today, and our stress levels are so high, yours and mine and everybody else's, right? I mean, most people I know who come into me work at least 6 days a week, and we're in our, 60s, 70s, and whatever.
That's right.
Plus.
That's right. So managing expectations is important.
Exactly.
But then again, looking at the whole situation, you really want to, how could I put this?
What I want to do is improve your quality of life. I want you to come in and say, this is what I'm feeling now. And on a scale, let's say it's a 10 plus, pain, fatigue, whatever. And now, Molly, 3 weeks in, I'm feeling at a 5. And hopefully in 5 weeks in, you start to feel like it's a 0. And this is what I want, but we can't say that for every patient.
So it's patient-driven, really.
Right, exactly right. It's patient-driven, expectation. And again, it's also what other things you're doing. And I want to reiterate the fact that and I know it's not just what we put in the bag, although what we put in the bag is excellent and it certainly will help you. But you might have to make a few changes in life. Not too much that you feel like, oh, what's the point of living? But you do want to change maybe some of your eating habits, some of the dietary, that kind of thing. And also take some oral supplements, as you know.
Which you recommend.
Right. But again, we're not out to sell you the most expensive brands. I have so many people who are using Rescue, right?
Yes.
I mean, I'm giving Rescue a plug on my show, but it's true. I have so many people using Rescue, and we know Rescue's good products. So why won't we want them to continue that? We may augment with something else because of their challenge. But again, that's how we operate.
We are coming up on our first break of the morning. It's Health Watch right here on Talk Radio 1210 WPHT. Every Sunday, 8 till 9, right here on the program. And if you have a question for Dr. Molly, 855-839-1210 is the number, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I are coming back with more of today's edition of Health Watch right after these words. We are back here on Health Watch, and as always, when we're on the program, operators are standing by at Innovative Medical Associates. And the number, 856-489-0505, 856-489-0505. When you call, you want to make that appointment to sit down with Dr. Molly and go over your situation. The initial consultation is complimentary, so it doesn't cost you anything, and you will really learn a lot about what she can do to help you. 856-489-0505 is the number, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. We had a question this week about how you can listen live.
That's right.
Out of town, and
Right.
You just go to Odyssey.com and you can pick up the station, and that's plain and simple. Or you can download the app. It's as simple as that. And if I can do it, you can do it. All right, Odyssey.com is the website. Health Watch is the show every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. 855-839-1210 is our number here in the studio. And you really cut your teeth on vascular disease, but now it's really becoming more complicated, Dr. Molly.
It is, John. Vascular disease is actually any condition that affects the blood vessels, whether that's the veins or the arteries. Initially, I would say we cut our teeth on something called PAD, peripheral artery disease. And again, I see a lot of that. And usually that is concerning the cardiac issues that we see, brain, stroke issues, that kind of thing, John. And in particular, what that tells me is the PAD condition is generally an organic condition that is fat or calcium related or blocking the vessels. And, generally people we can avoid in the old days and still today avoid some surgical interventions, but that's usually the procedures are surgical or procedural in nature for the PAD types of conditions, whether they put in a stent or a couple of stents. And in one case, I had a poor guy, he had 5 stents.
Wow.
And you know what? By the time he got to me, I said, man, you need to keep those stents open. And of course, we did that with something called chelation therapy. But again, that's a particular condition. But I also look at vascular disease functionally. So I look at it 2 ways, the organic, which was just discussed, but I also look at functional peripheral vascular disease. And that's damage to the arteries and the vessels, and it's like swelling. It's like what? Inflammation, the old devil, inflammation. And lately, I've had many people who've come into me with this type of vascular disease where they cannot pinpoint exactly what the problem is. And this is after extensive testing, John, where I do maybe do a cardiac test that was invented by Cleveland Clinic and looking at, lipids and breaking down proteins and all of these things. And still, these people tend to have all kinds of problems, whether it's neurological, whether it's spasms, whether they have pain in their legs and not just in the chest, this kind of thing. interesting. So when I look at this, I start looking at the pain, the aches, the fatigue while walking and exercising and that kind of thing. And if we ruled out that they don't have the actual buildup of fats or whatever, I believe we are looking at inflammation that may be caused by some outside source. Does this such as a multiple chemical sensitivity, viruses? We're seeing more and more viruses like COVID-19. I've had people who come into me post the shots that have had this type of condition, and it's been quite interesting. They've also had the neuropathy associated with this, the tingling, but the early symptoms are the ones that I really try to hone in on, which is the tingling, the burning, little numbness, maybe some muscle weakness, cramping, some atrophy where you can't quite do what you have to do. Undetected sores on the feet. I had a case like that. Like, why? The skin eruptions. So, you got to look at this. Then I've seen people who've had this type of vascular condition who have the autonomic neuropathy associated with this. In other words, where they have the blood pressure rise and fall, heart rate sweating, bowel and bladder problems, digestive problems. Man, am I seeing a bunch of digestive problems that are unrelated to anything else but some type of inflammation, vascular inflammation.
So throughout all of this, your protocols, your procedures, are they able to, let's just take a stent. Are they able to prevent people from getting stents?
Well, yes, if you truly have the PAD, yes, which is the peripheral artery disease, of course. Chelation has been known to do this for quite a while. But even more importantly is what happens if you've had the stent. How do you keep it open? Chelation is one of the ways to do that. The EDTA claws out, and we touched on that last week. But I'm really looking at this functional peripheral vascular disease, the damage it does from head to toe. So, why is this happening? And I'm telling you, it's happening because of it's really happening because of autoimmune responses. Now, is it the toxins? Are we seeing more mold issues? Or are we seeing more viral issues? Or some combination of this? What is causing us to have inflammation head to toe along our vascular highway?
It would be all of the above, right?
I think it's all of the above. And man, when patients come in like this, you've got to step back, and the doc and I have to sit down and really put on our sleuthing caps because, okay, why does this patient have all of these symptoms? What type of autoimmune disease is this? Well, you're going to do some testing, right? And we do. So we run some very complex tests, and we don't like to spend our patients on some of these obscure tests that are out there. We like to use LabCorp Request, where their insurance can pick up that tab. But we want to use traditional laboratory tests that may look at things like some certain types of white blood cells that are immobilized when you have inflammation. And looking at those, we can say, look at this. This is inflamed when we have these vascular diseases.
It's another one of those puzzles that Dr. Molly has every week.
And pushes my docs and my nurses to really look at this and say, hey, what is really causing this person's problems? And when they're so complex, you've really got to get into this, you really do. So here's the thing, John. The other thing is I have many diabetic patients who come into me, and we all know about diabetes and neuropathy, diabetic neuropathy. Well, diabetes itself, is that an autoimmune disorder? It can be a biochemical disorder that is brought on by your bad lifestyle, or is it a genetic disorder, or is it a combination of all of that? What do you think?
I would think it's a combination.
I think you're more than correct. It can be. But let's go back to you. Did anyone in your family have a history of stroke?
No.
That's and you and I know you have you have comorbidities. But how did you get them? Well, you were working too hard. I can tell you. We had autoimmune disorders. Your particular lifestyle. I mean, when you're on the radio, you didn't always get to pick the time your show was, so you may have worked an overnight. I'm talking about what led up to some of these things, not in the moment. Now we're a couple of seasoned people, so we pretty much put our own schedule together. But when we were younger, I don't think we were really in thinking about all of these things. And so what happens now? Let's talk about what traditionalists do for this. Well, immediately in the first line of defense, if they find out you have diabetes, generally, assuming that the physicians believe a oral will help you control your blood sugar, they'd put you on metformin, right? Everybody knows about metformin. In fact, some of my patients have used metformin for weight loss, and I can tell you good and bad about this. So what does metformin do? It is a medication. It's been around a long time. It's one of these oldies but goodies. It's not a terrible medication. But what it can do is it can lower certain B vitamins, which is why you also want to be a lifer. Right. Okay. It can lower certain B vitamins. In particular, it can lower B12. It can lower folate, which then can what? Decrease blood flow. It can increase your homocysteine. And why do I talk about homocysteine? Because it's an inflammation marker. Okay, but this is an easy case because someone has a condition, right? Okay, it can damage your blood vessels, which cause you pain in the feet, in the legs, nerve damage. Now, low vitamin B, right? What will that do? It reduces the ability of the body to repair your nerves, the nerve endings. So we need B. We definitely need B. So here we have a situation where what came first, the genetic dysregulation or the lifestyle? And when I look at homocysteine, I'm looking at that also from a scientific point of view. So I might want to run a traditional genetic test that is covered. It's a traditional test. It looks for some dysregulation on a particular gene marker, and this marker is MTHFR. And MTHR is a genetic variant that can be present in about 50% of our population right now. And it reduces the folate levels. So this then can contribute to the folic acid being depleted and the B vitamins being depleted. And what do you think happens if you have that along with some of the side effects of the metformin?
Oh,
it's bad.
You're in trouble.
You're in trouble. So how do we in our facility go about this? With medical hydration, including certain B vitamins. You hear me talk about that all the time. Methylated. We look at hydro B vitamins. We will look at things like alpha lipoic acid. We'll look at things like riboflavin. So these are just some of the things. And again, I'm using extracts that are absolutely food-based.
You know, through all of this, and I'm listening to you, and I'm thinking to myself, everybody could benefit from a visit to Dr. Molly.
Exactly.
Really, that's the bottom line. And so we encourage you to call the operators who's standing by right now. And we are coming up on the halfway point of the show, which means that you still have plenty of time to call in. Dr. Molly would be happy to answer your question or your medical challenge. 855-839-1210 is the number. 855-839-1210. The show is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. I'm your host, John DeMasi. We both return. Dr. Molly and I will come back with more of today's edition of Health Watch after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and their number, 856 856-489-0505. Again, 856-489-0505. When you call, they'll be happy to answer any questions that you may have. But most importantly, you want to make that appointment to sit down with Dr. Molly and go over your issues and situations, and she will take care of answering that question. 856-489-0505. And again, the initial consultation is complimentary. Take advantage of that. You will learn a lot. And, of course, the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. The show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones, talk to Jill in Levittown. Jill, good morning. You're on with Dr. Molly.
Hi, Jill.
Good morning. Good morning. How are you?
Good. How you doing?
Okay. So I have a question. I was recently diagnosed with ulcerative colitis.
Yes.
I know you were talking about it a couple of weeks ago, and
Yes.
I was fairly healthy, and it just came out of nowhere. So my question is,
okay.
Go ahead.
I was going to ask you. Tell me what you're doing for it right now. Tell me what you're doing for it.
My radio's off.
Oh, okay.
You might. Okay, maybe it's my TV in the background.
I'm sorry. Okay.
Shut that off. Sorry about that.
Yes, thank you.
Well, what are
that
you
better?
doing? What are you doing for the problem that you're having? That's Dr. Molly's question.
Okay, so I've been on budesonide and I was on prednisone at first,
Of course.
and I went off that. And recently, I didn't want to do it, but I had to go on the biologic, which is Entyvio.
Okay. And how are you doing with all these?
I've been doing better, but I think it's before I was even on the budesonide. My hair has been falling out, and
Yeah.
they told me it's from everything that I went through.
Mm-hmm.
Because I did go to the can't think of what it's called now.
The GI.
Dermatologist.
Oh, the
And,
dermatologist as well. Sure.
Yeah, she gave me a name, what it's called. She said it will come back, but it's like thinning, and I don't think it's from the biologic, but it's just I had to go and get a few iron infusions because my
I'm
my
very familiar
hemoglobin
with
was.
that. Yeah, I'm very
Yeah, it's
familiar
just-
with this. Yeah.
It's just been a mess, and I went to like 2-3 doctors because a couple doctors in Philly were not. It was taking so long to get some help, so I
Sure.
just recently switched, and I don't know. I'm wondering like any advice you can give me, and
Well,
if I came to you.
Okay. First and foremost, well, yes.
Go ahead.
I hear you, and I can sympathize with you, and I have several patients who have ulcerative colitis, several of whom been with me quite a while. Now, the question is, it sounds like you're pretty severe, obviously, with the hemoglobin the way it was. You're having bleeding. You've got a severe situation. I find this very interesting. What about your diet at this point? Anti-inflammatory in nature? or-
Yeah, I mean, in the beginning, I was like just doing like rice and applesauce, and I lost 20 pounds, and
Okay.
I've gained some of that back.
Good.
I also, prior to this, I got attacked by 2 German shepherds, and they put me on. Yeah, so
Oh, my
they
God.
put me on clindamycin, and then
Of course.
I was having issues with my stomach, and then they
Yeah.
put me on. I can't think of the other name, but they thought I had C. diff, and I didn't. I didn't have it, so I was taking all these antibiotics, and I'm wondering.
I bet you that
you
helped.
know,
that
the
helped you
doctor-
get this
'cause I
condition.
said, did it come? Did I get ulcerative colitis from this?
No, they would say no, but I certainly can tell you it probably helped tip the. In other words, when we have a propensity for an autoimmune disorder, right, which is the way we look at ulcerative colitis,
Right.
and you take something from outside, that can tip you over the edge. You know what I mean? It certainly contributed to that. Let me ask you this. Are you on probiotics right now?
I am.
Okay.
I've been taking them for 3 months now.
Okay, and I hope they're a good brand. I would tell you, I can't give you.
It's the BSL-3.
I can't really tell you what. Yeah, I don't rep any of those companies. In fact, I don't rep any companies. We're very particular about some of that. Are you taking any digestive enzymes?
No, I'm not. I'm taking like a D and a just your basic.
Okay, and you're taking these orally. You're taking these orally, right?
Yes.
The D3.
Yes.
Yeah. Okay. Listen, I'm going to tell you that given the condition you're in, you need some hydration therapy. There is no question in my mind. In addition to that, one of the things we have that. Pardon me?
Go ahead.
Pardon me?
Go ahead.
Oh, okay. One of the things that we do, in addition to the hydration therapy, to get you the B vitamins, to get you the iron, to get you the folates, the folic acid, actually the folate acid. The other thing is you might need some amino acids, and we would probably put you on a clinical dose of a pharmaceutical that we use in tincture. We're having great deal of success with utilizing this. Now, it's not a magic bullet. It isn't holy water. It takes time because you have to heal up all that inflammation and that inflammation problem.
Right.
But I can tell you I have several patients that have gone to a very large institution who has especially looked at GI problems, and famous guy here in Philly, and his patients are doing better on my protocol. I'm not telling you to get rid of any of your medication, but lots of my patients were able to get off of the prednisone and the biologic. But it does take time. You cannot just throw those away. You can't. So,
right. I know. I mean,
okay.
I
definitely.
feel like
Go ahead.
Yeah, I
dear.
feel like the biologic is helping. It's just with the side. I mean, I haven't experienced them yet, but I'm like really nervous about that.
I
down
understand.
the road.
I understand. It's a long-term deal, and it can have really bad effects. So God bless you in this journey. I think we could help you. But again, this is the kind of thing that takes time, time.
Yeah.
But there's no way that you're getting all of your nutritional needs met right now orally. No question. God bless you. God bless you, dear. I'll be praying for you. So.
And feel free to call Dr. Molly in the office. And thanks for the call, Jill.
That was a good call.
No, that's
There's inflammation.
Yes.
There's inflammation. And listen, I have several patients, and a couple of them that have this condition and are doing pretty well. But they have to maintain, and they do have flare-ups. Look. Bottom line, this is the kind of thing that ebbs and tides, but they'll tell you they manage to get through their flare-ups a little more quickly since they've been coming to our clinic.
All right, 855-839-1210, and we're going to pick up what Dr. Molly was talking about before the phone call.
Oh, sure. I was really talking about, global inflammation. And one of the things I want to say is the reason why I love medical hydration, not spa hydration, okay? It's nice if you don't have a problem, great. You want to get over your hangover, great, go. But when I'm looking at medical hydration, I'm looking at this specifically for the management and the management of distinctive nutritional needs resulting from your particular challenge. The formularies are really specific to the patient. Patients who cannot normally metabolize ordinary food, who again have dietary issues that can't be met through normal living. And how many of my patients have that? Most. Oral intake is not good. And actually, I have people who are actually come to me that have a feeding tube, and they're still not getting it. You know why? They're still going through that GI pass. So this is the best way to get your nutrition through medical hydration, specific medical hydration for your particular problem. And you and I know, John, one of the biggest devils that get us all is inflammation.
That's right.
And there it is.
We are coming up on our final break of the morning, which means you still have time to call in if you have a question or a medical challenge for Dr. Molly. 855-839-1210 is the number. 855-839-1210. It is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We will come back with more of today's edition of Health Watch right after these words. We are back here on Health Watch, and again, operators are standing by right now at Innovative Medical Associates. You can call now, or, they'll be there after 9 o'clock when we leave the airwaves, so feel free to call them then as well. 856-489-0505. 856-489-0505. That's the number for Innovative Medical Associates, located in Marlton, New Jersey. And, of course, their website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Check that out. A lot of good information on that as well. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or a medical challenge, we still have time to take your calls. 855-839-1210. Want to give you an update on some of Dr. Molly's out-of-town patients, because we tell you this because we kind of want you to see how it works with other patients and how it could potentially work for you. So talk about your out-of-town patients.
Well, actually, Betty came in for a tune-up, as we like to call it. She had some systemic pain. She's already had knee replacement, and she said the knees are okay, but she's still having other pain, fatigue, etc. Now, it's been about, I guess she came to us about 5 months ago. So it was time for her to come in, get some nutritional support, which we did. We also did a little regenerative medicine for the pain in particular areas. I have a great doc who's great in doing that. And also, at the same time, we readjusted her nutritional prescription, I like to call it, for her to go back home. And she actually flew out, and we actually touched base earlier, I think on Saturday. So she left Thursday, touch base on Saturday, because I'm starting her on our weight reduction program, which is the use of peptides, something I'm extremely interested in, the use of peptides, natural peptides that the body produces that can help cut the appetite and help us move ahead. As a matter of fact, I'm starting her, but of course I wanted to check in, doing this from afar. It's a kind of thing where you want to stay on top of the patient. So that was the one patient I did. I think I was talking about someone else too before the show, John, and now I can't remember who. Okay, so
you have so many patients.
Well, I had such
pick one.
Well, I really had quite a week. Oh, and yesterday I had a follow-up conversation with another out-of-town patient who actually is in keeping with Jill said has Crohn's and colitis, a combination of both, and he's doing pretty well. He said that the pain has subsided based on what we're doing. He's following the regimen of the oral products that I sent him home on. I told him he needs to come back in 4 months. He's also utilizing that subclinical dose of what I told you, an off use of a particular pharmaceutical that's a very old one. And he said, wow, he said, I think this thing has really kicked in for the pain. I agree. And I asked him, well, how are you doing with your fatigue? He said, quite well. His wife was on the line with me. We went through his particular test that I didn't get back for the week he was here. It took a week because it was the genetic test I was telling you about. He definitely has the dysregulation. On top of everything else, he has the dysregulation for the B vitamin. So not only was his condition contributing to his problem, but he has a genetic propensity for this as well. So he had a double whammy, and he's starting to feel better on what we're doing.
Wow.
That's my week.
No wonder you kind of
Today,
wonder where you're going to go.
Well,
because-
today, Dr. Molly, I won't say I quite feel my age. I want to get out and walk since it's such a beautiful day. But I can tell you that I've had a little bit of a windmill kind of last few weeks, and I have 2 other patients coming in from out of town. By the way, one of which who has the exact condition and is on the same medication that Jill's on. That's going to be an interesting case. She's a young woman, 32 years old.
So what are you going to do for her?
Well, exactly what I told Jill. I'm going to send her out for some testing. I want to make sure that I have all the paperwork. I did get it from her nurse practitioner, who I'm working closely with out of town. And I got all of the results from her scope. It shows that she doesn't have cancer. She definitely has what they believe is ulcerative colitis. She's having some trouble. I'm going to put her on a dietary regime when she goes home. But in the meantime, I'm going to tune her up with super therapeutic levels so that she can maintain, put her on a subclinical dose, a couple of other things. In particular, I want to look at her nutritional status right now when she comes in. So this is her first visit. We'll see.
What is the prognosis for someone like this?
As I tell you before, John, it's an ebb and tide because this condition is, and our stress level affects this condition no matter what you say. It does, even though the conventionalists may think that's in your head. It is in your head. It's stress related to, cortisol and adrenals. And, as I told you before, the gut is the little brain, so there's a neuroendocrine relationship that has to be addressed.
So would you say that this person would be a lifer or close to?
I think I'm finding that they are a lifer in that they must come back, and we do the tune-ups probably quarterly, that kind of thing. And it depends on how well they control their outside, their lifestyle,
Do you ever have any easy cases?
Well, no, we
Just
are.
Thinking about that.
Listen. No, we're not a spa. We are a medical hydration clinic. Our focus has been on that. We believe it's one of the ways in with God's ingredients and God's help to help people have a quality of life. That's it.
And that's what you do. That's what you do.
That's it,
We're
John.
not finished yet.
Oh, good. I'm ready. I don't know why. I guess I thought
you want to leave early.
I thought we were leaving early today. I don't know, John. I thought the way you were wrapping up. Anyway, that being said, no, there are no easy cases, and in this particular thing, the GI cases are very complex because. Again, there's a neuroendocrine relationship, and unfortunately, most times what happens is in the beginning, when they're not too serious, what happens is the healthcare provider may dismiss them, particularly since it affects a lot more women than men. But when men get this condition, it's terrible. The gentleman I'm speaking to out of town, it really was interrupting his work. So again, it's going to depend. It's got to be patient specific, John.
You have a lot of those situations where a patient comes to you and says, "Hey, I went here. I went. They can't help me."
Well, here's the thing. I think it's very important that people realize that in some of these autoimmune conditions, you've got to, as I said earlier in the show, at the beginning of the show, I said you've got to be sleuthing on these things because, just because you're having problems in one area, it doesn't mean that there aren't other areas that are affected that are globally affected. And again, if we look at inflammation being the universal problem, you will find that we need to address this piece by piece by piece. And that includes the lifestyle changes, what we do, bringing in the medication if need be. And, it's just a puzzle.
As you say, inflammation is the devil.
It is, John. It is.
And with that, we're going to put the wraps.
Thank you, John.
On another edition of Health Watch. Don't forget, operators standing by right now, and they will be there well after we leave you at 9 o'clock. They're not tailgating at the Eagles game. They're not doing any of that, okay?
Go Eagles.
856-489-0505. 856-489-0505 is the number. And the website, InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel, And then, of course, there's Delightful D, Joanne, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We'll talk to you next Sunday, 8 o'clock, Health Watch, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.